is born, someday they'll be full of hopes and dreams. It won't be very long till they move out on their own, 'cause that's the way that life's supposed to be. But something isn't right. There's a lost look in their eyes. They're crying out, why can't you just see? I'm in here when the joy turns to crying. See the world through my eyes for just a moment in time. I'm in here, oh don't you know I'm trying to find a way to show you who I am.
Recent statistics show that autism affects 1 out of every 100 children. Many parents have an inclination that their child has autism even before a doctor has given an official diagnosis. Others are surprised and dismayed when a referral for a diagnosis is made by someone in a child's life. The process of testing to determine if a child has a diagnosis of autism can be overwhelming. Where do I go to find out if my child has autism? What kind of testing will it require, and who pays for it are some of the commonly asked questions. This is Jamie McGilvery from Beaumont's Hope Center. Today on Spreading Hope, we will show you firsthand how a family experiences a diagnosis at Beaumont's Autism Assessment Clinic. You will hear from a family that went through a diagnostic evaluation from beginning to end. We will also explore ways of examining the best treatments for your child once a diagnosis has been made. Many parents find themselves in a position of feeling that something is not quite right with their child. Some parents are told that they're just being overly sensitive or that their child is most likely just a late talker. But parent instinct can be a powerful thing. It's challenging to make decisions though when your instincts are screaming one thing and the others around you are telling you something else. There is really only one way to find out. Make the call. Set up an appointment to have a team of specialists evaluate your child to determine if your gut instinct was indeed correct. Support staff at the Center for Human Development are always happy to answer families' questions. Let's listen in as Anne explains the general process of an evaluation to a parent calling in with questions.
What we do is we start out with a parent-only meeting, and that meeting lasts approximately an hour and a half, and you will meet with one of the early childhood psychologists, and they will go over all your concerns at that visit. And also, if you'll bring in medical records, birth records, and there are questionnaire booklets to fill out for that visit. And when you bring all that information in, they go over all that with you. But generally, a test for a 2-year-old would consist of 2 visits with the psychologist, lasting probably about an hour to an hour and a half each. 1 visit with what we have here, a developmental pediatrician, and that can go anywhere up to 2.5 hours. And she is a specialist in developmental. And after those 3 testings with your child, they do a team meeting where the doctors get together and go over all the testing scores. And if there's anyone you wanted invited, a preschool person or any type of speech therapist, anybody else could be invited to that professional staff meeting. And at the end of that, they pull together all the recommendations to give you on your final parent meeting.
Some of the most common questions families have when calling in pertain to insurance.
How it works here is we are what's considered out-of-network providers. So what that means is we do not bill your insurance and take payment from them. You would be responsible to pay us and then seek the reimbursement. However, we do give you an itemized receipt with all the procedures on it that you would need to send in to them. Now, in the information packet that I will send you first, it will have the exact questions to call and ask your insurance to find out what type of out-of-network coverage you may have, and at that time they should be able to give you some information how to submit your receipts and that type of thing.
Many of the questions families find helpful to ask their insurance companies are, do I have out-of-network mental health benefits for non-participating providers? What is the out-of-network deductible? What kind of reimbursement can I expect? Do I need a pre-authorization, and if so, how do I obtain it? And lastly, what address do I mail my patient receipts to receive reimbursement? At Beaumont's Autism Assessment Clinic, clinicians begin with an intake. At the intake, information about family history and your child's behavior is collected. A multidisciplinary approach is used, meaning you and your child will meet with the psychologist and a developmental behavioral pediatrician. It's important to rule out any underlying medical conditions or genetic disorders when trying to rule in or out a diagnosis of autism. After a thorough medical examination, psychological testing will be administered. Some of this testing occurs with parents in the room. This type of testing is called standardized testing. Results will allow you to compare the behavior of your child to that of other typically developing children. It's called standardized because it is administered the same way for each child. After all of the testing is conducted, the professionals will meet to discuss their findings. This ensures that all of the professionals are in agreement with the final diagnosis. After the professionals have discussed the findings and have reached a conclusion, the parents will return a few weeks later. This meeting is called a parent conference. While receiving a diagnosis of autism can be devastating, it is most advantageous to do so as soon as possible. Research shows that early intensive intervention can have a significant impact on children's lives. The sooner the diagnosis, the sooner the families can have a plan to intervene.